The Community Firearm Violence Prevention Network is an NIH-funded research network that focuses on collaborations between academic and community organizations to address the public health crisis of firearm violence, focusing on community-level strategies to prevent firearm injuries and deaths. The goal of the network of research sites is to develop, implement, and evaluate innovative community-level interventions to prevent firearm and related violence, injury, and mortality in partnership with communities. The vision includes a coordinating center, based at the University of Michigan Institute for Firearm Injury Prevention, to lead the network by providing cross-network coordination, technical assistance, analytic support, and support for community engagement and dissemination efforts. The research interventions are conducted by George Washington University, University of Chicago, University of Mississippi Medical Center, the University of Texas Health Sciences Center, Houston, University of Arkansas for Medical Sciences, and Eastern Michigan University. These awards were funded as cooperative agreements, which means that NIH staff provide substantial programmatic and scientific input and are equal partners in the work. This network has been established to build research capacity in the field by increasing the amount and the quality of research, which will lead to more and higher quality linked data. Through coordination and harmonization, we are able to answer research questions with an increased level of confidence compared to standalone research projects. The goal of the network is to produce more than the sum of its parts. Now let's hear from some of the people.
The advantages of being part of a national network is both that we can move this work forward in a way that a single project couldn't do on its own by collectively consolidating all of the work that's going on across these individual projects.
We can no longer afford not to be connected, not to be coordinated. It needs to have a comprehensive approach. A network like this shows that we all need to be together having these conversations and learning from each other and challenging each other.
Advantages of being part of a national network. I will say one, it brings attention to the rural Southern context. We're very, very excited about being a part of the network. We get a chance to be a part of the national narrative.
A lot of times we realize that our problems are shared problems, and that really, if we can identify techniques that can also be shared, that we'll see greater outcomes.
And there's also so much networking. So being able to connect with people who are currently in this field, learning and growing from them, developing new colleagues, new mentors, new friends, and it's really exciting time for us.
Coordinating can sometimes, create conflict, create the need to kind of negotiate and, come to some kind of agreements where sometimes you have to make trade-offs as a researcher when you're working in a network. So I think there are some costs involved, but I think the benefits outweigh those costs. And those benefits are, a common knowledge that can be shared across community. I think we increase our potential influence because if we have common measures, we can see if what we're doing is making some similar kind of differences. And so there's power in many, and it gives voice to a larger and wider audience.